COVID-19 has touched all corners of the world. When we thought we were getting free from COVID-19, Omicron emerged. Since it emerged in mid-November, Omicron has raced across the globe like fire. Though it has milder symptoms, same as flu, the World Health Organization has warned that Omicron cannot be dismissed as a common cold or a mild disease. There are reasons to worry about it. People with diabetes and heart disease can face severe complications. Due to the previous lockdown and work-from-home culture, people's lifestyles are severely disrupted. Many people have become physically inactive and developed irregular eating patterns, which leads to unhealthier lifestyles and aggravation of lifestyle-related diseases. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down the diabetic epidemic and heart diseases. Beat diabetes, myths and facts will impact and help a large number of people to prevent or control metabolic disorders. Today we have with us experts to share with you advice on leading a healthy life. So if you have any questions you would like to ask them, send them to us via WhatsApp to the number +9191 67 666 941. That is the number to send us your questions for our experts, to also send in your name and your location. Let me introduce the guests to you. We have with us Dr. N.K. Das, MBBS, D-Diab, Consultant Diabetologist, Diabetes Care Clinic, Yashraj, Medical Nagaon, Dr. Jiljith K, MBBS, MD, Consultant Physician and Diabetologist, Speech and Specialty Hospital, Kannur, and Dr. Kapil Kumar Goel, MD, Medicine, Consultant, Vejas Patel Hospital, Rourkela. Thank you all so much, doctors, for joining us today on this very important subject. Dr. Das, I would like to start with you here. It is believed that Omicron infected people experience relatively mild symptoms. However, some patients do experience high fever and severe cold and cough. Can it cause major damage to the health of people? Should people worry about, people suffering from diabetes? Should they worry more?
Thank you very much for your kind explanation of this disease. Though Omicron is considered as a milder form of COVID-19, but it is not to be considered mild because a viral disease can be dangerous for the patients with type 2 diabetes and heart disease, because glycemic control is very essential parts of this disease, which is disturbed by Omicron COVID-19. That glycemic variation may create some problem of heart, kidney and other problem, and glycemic variation is to be controlled nicely during the COVID-19 affections. So it is better to stick with the diabetic management so that glycemia should be within control and complication does not arise, because that is the thing which is to be considered prime factors in management of the diabetes in COVID-19. Thank you.
Okay, sure. Dr. Jiljith, in the midst of the surge in Omicron cases, one of the most frequently asked questions is how long should an infected person should stay in quarantine? If this infection is not so severe, then is it okay for the person to get back to his or her routine as soon as he feels better, or should they isolate and quarantine?
Okay, so first we have to understand what is a quarantine period. Quarantine period is the upper limit of incubation period of the virus. So initially it was 14 days. Now the center has revised the guidelines to 7 days in current scenario. In the midst of surge of Omicron cases, in the mild positive cases or asymptomatic patients, the people should be isolated for 7 days. And if after 7 days, if you are symptom free, then you can get back to your normal routine activities even without a negative test report. But we have to follow precautions like wearing mask everywhere in a home, and maintain social distancing and proper sanitization of hands. Thank you.
Okay. So, Dr. Goel, since we've understood the quarantine period as well as how we should still maintain COVID protocol and stay isolated, tell us the most accepted and commonly used method of diagnosis of the SARS-CoV variant is the RT-PCR method. Does this method detect the Omicron variant as well?
Yes, RT-PCR method is not new to the science. It has been already used for detection of various viruses in the laboratories. So by this RT-PCR method, we generally multiply the different variants of the virus, and in similar way, Omicron variant can also be multiplied into multiple copies, and then it can be easily detected in laboratories. But the only limitation with this method is the availability of chemical substituent, which we call as primer. So a particular primer has to be set in the laboratory that will bind to this Omicron variant, and that will help in detection of the virus. So it can be widely accepted and is the most reliable and gold standard method to diagnose any particular virus, but with limitation. So it should be more limited to the research purpose and to constrain the virus rather than widely using in local or for detection. Still till date, we have antigen as the best an inexpensive method to detect various virus, whether it is a COVID infection, maybe it Delta or maybe it Omicron variant. But RT-PCR is the gold standard method.
Okay, sure. Thanks for explaining that. Dr. Das, tell us, after recovering from the Delta variant of COVID, many people suffered from hyperglycemia and they were advised to check their blood sugar levels regularly. Is it also necessary after recovering from Omicron?
Yeah, frequent glycemic control should be done for the patients recovering from Omicron, because it is also viral disease where glycemic variation is usually occurs after the recovery of the disease. So glycemia should be controlled strictly to avoid the further complications after recovering from this disease.
Okay. So, Dr. Jiljith, tell us, diabetes is an immunocompromised condition and people with diabetes are more prone to infections. What particular care should be taken by people with diabetes to avoid infections?
There is no enough data that's suggestive of that diabetic patients is getting more infections compared to other general health population. But the problem is with the diabetic phase, if they get it, they will go to complications compared to other people. So regular exercise and diet is the vital management in diabetes. It will enhance the stability of the glycemic control and it enhances immunity. So prefer low glycemic index foods like vegetables, lentils, avoid fried foods, carbohydrates, sugars, etc. and keep an extra attention to your blood glucose levels.
Okay.
Check the sugars periodically. It will help to prevent the complications that arising from high or low blood sugar levels.
Okay. So a holistic approach towards life is really important, taking care of your health and what you're eating. Dr. Goel, like Dr. Jiljith just told us that how it's important for diabetes to really take care of one's health, what they're eating. Can a healthy lifestyle such as regular exercise and nutritious diet help to reverse heart disease or reduce the risk of developing heart diseases?
Yes, definitely. Heart diseases come under a non-communicable form of disease, which is influenced by various factors, and there are various risk factors associated with it, like sedentary lifestyle, lack of exercise, improper diet, and addiction to alcohol or smoking that may lead to several heart diseases. So at early detection and early initiation of the treatment, like regular exercise and abstaining from alcohol and smoking, and then maintaining a proper diet, definitely helps in reducing the severity of the disease, as well as it, in some cases we have seen that it reverses the disease process also.
Okay.
So that comes under a primary form of prevention, which we usually advise to our patients. So that is really helpful to maintain a proper diet always, and exercise. Thank you.
Great. So, I mean, basically it's about leading a healthy lifestyle. On that note, we are going to be taking a short break. And if you have any questions you would like to ask our doctors here, our experts here on the show, please send them to us via WhatsApp. The number is +91 9167 666 941. So please send us your questions and our experts will answer them for you. We're going to be taking a short break. We'll be right back. Welcome back. You're watching Beat Diabetes. Starting with you here, Dr. Das, working from home is a necessity till things really get normal. What steps can people take to ensure that they do not put on weight while working from home? Because this is what we saw earlier as well. You know, people were eating wrong, they weren't exercising. So what steps can they take?
Actually, working from the home during the COVID session is an essential part of the treatment, because as the patients has to be attended by the doctors, they are to be contacted on online or virtually by WhatsApp method. Then we can discuss them with their report and we can suggest their treatment, and every time we will provide them some tips about diet and during this working from home. Usually we the doctors usually put weight, but if we take to do anything, suppose to take a phone, while taking phone we can move around and to discuss with the patients, that will create some form of exercise. Or if we uh, go through a stair, that is give you some exercise. Only sitting is not will not give you the exercise. If you stand even, it will create some exercise also. So while working from home, put some weight, but with diet and exercise, along with the uh, frequent movement,
Sure.
we can reduce. If we do some physical exercise by sitting or standing,
Yeah.
that will reduce weight and give us energy to work for a long time.
So rather than sitting in one place, one must keep getting up, moving, you know, doing that little bit about a movement, and of course also, you know, doing that physical exercise if possible. Dr. Jiljith, globally diabetes is becoming increasingly prevalent as there are myths and misconceptions that surround it. Can you help us, you know, can you bust 3 of the biggest myths about diabetes?
Okay. It's a significant question because
Yes.
there are a lot of misconceptions between diabetic patients about their dietary habits. First myth of the diabetes, because diabetic patients cannot take sugars. They say that anything that tastes sweet should be avoided in diabetic patients. But they can, if they are sugar cravings or sometimes urge for sugars, they can take a fresh fruits with a normal quantity. No need to avoid carbs completely also, because diabetic diet is a well balanced diet. It contains equal amount of proteins, sugars, carbohydrates. For example, in West Bengal or South India, rice is being the main staple of the diet, but we can avoid completely. So again, moderation is the key, or cut size the portion of the food. Second myth, diabetes is a lifelong disease and it cannot be permanently cured. It's a fact, it's a true fact. There is no permanent cure for diabetes, but we can achieve early remission in early stages. Doctors use the word remission when diabetes is under control, and remission is told to the patients you are outward of symptoms of diabetes. The remission is of 3 types: partial, complete, and prolonged. In partial remission, blood glucose will be of normal of that diabetic range without medication. In complete remission, no OHS or no insulin is taken by the patient for 1 year. Prolonged remission means blood glucose will be returned to normal even without medication after 5 years.
Okay.
So early remissions can be achieved in diabetes.
Okay.
It will be achieved by healthy lifestyle, follow up with doctors, regular medications, and exercise.
Okay.
Third myth of diabetes. People's concern is obesity, only obese people who get diabetes. It's really a misnomer, because any weight of the any overweight or underweight, any patient can cause diabetes.
Okay.
The problem with obesity is they will go into complications like kidney disease, heart disease, and nerve damage.
Okay.
So obese people must reduce the weight, and it will create impact in glucose control, and need for insulin therapy and OH will be reduced. Thank you.
Okay, so you've explained, three important points that a person can have fruits, you can have carbs, of course, to a limit, you still need to exercise, and about remission, what you've explained really well, and also the fact about that even thin people can get, but yes, obese people can have complications. Dr. Goel, can you explain the need for long-term use of blood thinners like aspirin? Are these safe, and how does it help in preventing heart attacks?
Yes, aspirin is a form of blood thinner that is commonly used by us to prevent thromboembolic stroke, which we commonly called as calls as heart attack. So earlier we used to see more aged people come to our clinic with heart attacks and heart problems, but nowadays due to this sedentary lifestyle and then improper eating and then adulteration of the food and due to environmental causes, very young people who follow a regular diet also, they comes to us with heart diseases. So it is a common perception that aspirin should be used by old age people, but that is wrong, because aspirin is an antiplatelet drug which prevent from formation of thrombus that usually dislodge into the arteries of the heart and causes heart attack. So a low dose aspirin around 75 milligram per day can be started early on in those cases who have risk factors like hypertension and diabetes, and those who are obese and have high lipid levels, high cholesterol levels.
Okay.
So but yes, there are some limitation to aspirin use, because it can cause some gastrointestinal side effects, and there can be nausea, vomiting, and there can be bleeding disorders. So we have to rule out the cases like those who had a previous history of stroke, previous history of hemorrhages, or any bleeding disorder. In those we have to be very caution about using aspirin.
Okay.
But still it is a very good drug, and it is inexpensive, and it is a wonderful drug and have achieved milestones in treating heart diseases.
Okay,
So it is a very good drug.
Okay, thank
Yes,
you for
thank you.
explaining that. But yeah, of course, we need to take precaution, need to know about your own health before taking any sort of medication. Dr. Das, it would
Yes.
seem that a vast number of patients with diabetes are also obese. That's what we were talking with Dr. Jiljith as well right now. So is there really a direct relationship between obesity and diabetes? We have understood that even thin people can have diabetes, but tell us the relationship between obesity and diabetes.
Yeah, each and every people can develop diabetes, but with obesity there is major relation with the diabetes, because obesity is one of the cause of insulin resistance, and in diabetes insulin resistance is the major problem in Indian cases, like type 2 in type 2 diabetes insulin resistance is the major problem along with the low insulin level. So if we remove insulin resistance by reducing the weight, it will help to get the glycemic control nicely. Moreover, cardiovascular problem will be less if we reduce weight in case of diabetes. So it is seen that good relation with obesity and diabetes is seen. So to prevent the complications, along with the diet and exercise, weight to be controlled with proper diet, proper exercise, so to avoid the diabetic complications.
Sure, so it's important that a person has the right weight, maintain that that's really important. Dr. Jiljith, what are the factors that a person with diabetes should consider before using a home use blood glucose monitor for self-testing?
Okay. The main factor is the patient should be of sound of mind. They can understand what is the physiology of diabetes, basics of diabetes. Here comes the role of physician. They have to teach the patients how to collect the blood in home, how to test in glucometer. First, we have to thoroughly wash the hands before collecting the blood. Only a teardrop blood is needed, and it will be pricked in the tip of the finger. Then next factor is how to optimize the drugs. Some patients, the fasting blood sugar will be higher, so we have to optimize the drugs in the night. Sometimes postprandial blood sugars will be high, So we have to optimize the drugs in the morning. So that wise we have to counsel the patients. Not only the patients, but bystanders should also be counseled, because sometimes patient will go to hypoglycemia because of low sugar levels. So at that time, what to do? So equally, patient and bystanders to be well trained. Thank you.
Yes, and I think counseling is important. That's a very important point that you have put out there. Dr. Goel, in case a person has normal levels of lipids and cholesterol, is he safe from heart disease? Which other factors can predispose a person to a heart attack?
Oh yes. So there is a common saying in us, in doctors and physicians, that no one is safe from heart disease. Everyone at some point of time or in his or her life, they are prone to develop heart diseases. So as we have already discussed, that heart disease comes under a group of disease where there are multiple risk factors associated with it, and high lipid level, high cholesterol level is one of the factors, not the only factor. So there is a common misconception among people. They get their laboratory routine testing at some random lab, and they get their normal levels of lipid and cholesterol, and then they are happy and they roam about and they avoid all types of exercises and then start taking junk foods and follow a normal daily routine. And that may that is where the heart disease can creep in, and you will never know when it has progressed to a stage from where we cannot recover. So we have to ascertain various risk factors associated with it, and that we have discussed multiple times, that proper exercise, then proper diet, and then abstinence from alcohol, then you have to quit smoking, you have to maintain a normal daily routine, and avoid stress-free life. So that's all will help. So the only way to prevent heart disease is following these basic rules, and that will make a person healthy.
Yeah.
Thank you.
So I think following a good routine, basic discipline, eating well, exercising, taking care of yourself, I think that's very important. Thank you so much, doctors, Dr. Das, Dr. Jiljith and Dr. Goel, for sharing all this with us. Thank you all so much.